Good morning. This is Jericho Bahador, leader of Group 3, Section 1, XMUS. Our study is about communication approaches to facilitate delivery of nursing care to hospitalized special children. Communication approaches. Approaches utilized by nurses in dealing with special children. Delivery of nursing care. What the nurse do to the special child as a client, which includes feeding, giving medications, positioning, and performing nursing procedures. Special children. Children with physical disabilities, specifically cleft lip and cleft palate, and those with neurological problems such as autism and cerebral palsy. We have chosen this study due to the interest that came up from our PEDIAC concept last year in the second semester. And there is no one who have done a study comprising both physical and neurological problems. What are the characteristics of special children involved in this study? Physical, mental, emotional, and social. How do these special children communicate in terms of verbal and nonverbal techniques, receiving and transmitting messages? How do these special children react when they are hospitalized? What are the problems often encountered by the nurses when communicating with these special children? What are the different approaches used by nurses in communicating with these special children? To describe the characteristics of special children, to identify and recognize their different behaviors and reactions while hospitalized, to have an in-depth grasp regarding the difficulties encountered by nurses in communicating with special children, to determine the methods of communication used by these children. Our respondents are 10 male and female pediatric nurses who have experience handling special children. Take note, special children were not our respondents. And we have conducted the study at Children's Hospital along Quezon Avenue. Special children are the center of this study. These children have special needs, and they are inside the hospital environment. The nurses will enter their environment through the use of communication approaches, and these communication approaches will facilitate and promote delivery of nursing care, which are the feeding, giving medications, positioning, and performing nursing procedures. And of course, this will elicit a response from the child either in a positive or in a negative way, which can be manifested by their cooperation. The design that we have chosen is qualitative descriptive because we are trying to explore for different approaches other than the normal ones. What we mean by normal approaches? The normal ones are those that have no special privileges, the mainstreaming approach. The sampling technique that we have used is snowball sampling technique so that we can easily identify or determine those participants that are really qualified in our study. By a referring person, we can easily specify the characteristics of the participants in our study. The research instrument that we have used is an open-ended questionnaire for a structured interview, which are questions validated by 3 professionals in our alma mater. One from the research department of this institution, the other one is a pediatric nurse from our faculty, and the third one is the assistant to the dean of the St. Luke's College of Nursing. After validating these questionnaires, we have asked for consent of the hospital that we are going to study. Then after giving this consent and they have replied, we have made an appointment to the nurses or the participants that we are going to include in the study. And then after that interview, we have clustered and compared the data. And after clustering and comparing the data, we have concluded or make up the themes that will answer our statement of the problem. After comparing and clustering all the data, we have identified 3 themes that will answer our problems. First, the special child and its characteristics, the four domains of human development: the physical, the mental, the emotional, and the social. The physical aspect. According to the nurses, most of these children are bedridden, with contractures, some have bed sores, and some are spastic. On the mental side, these nurses said that these children are intelligent, they are wise, they are full of ideas. And in the social side, some of them or most of them are socially withdrawn. And on the emotional, they are compassionate, they are loving, they are sweet. Second, the problems encountered by nurses in feeding, giving medications, positioning, and performing nursing procedures. First, on feeding, most of them are uncooperative. These nurses said that lumalabas nga, tumatapon lagi kinakain nila. And then, sometimes they don't like what they eat. They are picky eaters, especially the autistic children. In terms of giving medications, they are also uncooperative primarily because of the taste of the meds. Then on positioning, they're just very irritable. And on the performing nursing procedures, they are very anxious, especially when they see someone wearing white uniform. The approaches utilized by the nurses. The third one. We have drawn a line of continuum in which the approaches are categorized into simple, to not so simple, to innovative and creative nursing procedures and styles. What are the criteria that we have used in categorizing these approaches? First is the effort exerted by the nurse in performing this approach. Second, the accessibility of this tool. And then third is the use of tools other than the normal ones, other than the mainstreaming approach. Let's go on the simple approach first. The way the baby does it. By talking like a baby, you're relieving the child's anxiety. Second one, the medical strategy, the sedation. This is usually utilized in terms of lumbar puncture procedures and even ventricular taps. The third one, don't forget the basics, the fundamentals of nursing. The procedures, the skills and techniques that are standards, that are universally accepted. And then the fourth one is like the normal ones, presenting reality to the child, not placing him in an isolation room. You are presenting the child what the world really is, not what you want the world to be. Then on the second part, the second category, the not so simple approach, the distraction technique. By distracting the child with the use of toys, with images or pictures, you are relieving or reducing the pain that he or she feels. And based on the theory that once you distract someone, you are occupying the nerve pathways so that it cannot anymore respond to painful stimuli. Second one, play with a smile. Simply the play therapy. And then the third one, in good terms. When the nurse is in good terms with the mother or the father or the relative of the child becomes also in good terms with the nurse. And then the fourth one is the carrot and stick approach. It's the reward and punishment approach. Rewarding someone or rewarding the child for a good behavior, for an enjoyable behavior, and punishing him by the way of not using corporal punishment, but in a way that you will not let the child play because he has done something wrong, like not cooperating for a procedure. Then the third category, the creative and innovative. First, not to pacify but to swallow. For every spoon that the nurse gives to the child, he or she will also give this pacifier to facilitate feeding. Because, as I've said before, Feeding problem is one of the most common problems encountered by the nurses in dealing with these special children. And the second one is leave it to the banana. This is an approach in giving medications, inserting or sandwiching the medication in two halves of the banana without the child knowing that there is really the medication inside it. Themes identified were first, special children, their characteristics, the four domains of human development. Second, it's a problem encountered by nurses in dealing with these special children. And third one is the communication approaches utilized by these nurses in dealing with these special children. Approaches were identified and were determined, but they should not stick on it. They should be innovative on doing these approaches. And one thing that we should always remember is that an approach is not universal. It will act on one child but will not on the other. We should be flexible and versatile. Again, thank you. Vote for us. This is Jericho Bahador, leader of Group 3 for Anyone Eximus.